All right, so this is just a quick video to show people how we deflate implants in the office. And the nice thing about doing a deflation with the salines is that it gives you a chance to start over and reassess. Sometimes people have had the implants in for decades and now they have more tissue or more droop. And once we drain them, they look kind of scary, just like after someone delivers a baby after pregnancy. But within a few weeks, they fluff up and they shrink back. And a lot of times people end up saying, this looks fine, I'm just gonna take them out. And sometimes they're like, okay, maybe I'm gonna do smaller, or maybe I'm just gonna do a lift. But it really helps people with their decision making because they can really visualize what things are gonna look like. So here we go. And basically, just prep the area. And we don't usually numb it because the numbing is another stick that doesn't feel very good. So usually it's just one quick stick. There it is. And basically we empty it out. The other thing that this helps us with is a lot of times people have lost all of their records. It's not the case on this one, but so we have no idea what they have in. So that makes it really tough to replace them. And I end up having to bring a lot of implants with me to surgery. And it's nice to know what the measurements were for the base width, the volume, and all these things that go into planning when we're doing another implant or taking them out. And it doesn't matter if we lose a little on the side here. This just gives us a ballpark idea. I can usually get them pretty empty, but we don't stress out if there's another 10 or 20 cc's left in there, because it will typically just resorb. And you can see this is just clear fluid. Breast implants are filled with regular IV fluid. And despite what you might hear, it's very uncommon to find anything in there like mold or anything like that. Occasionally it'll come out brown, which could mean there had been some blood. They used to put betadine sometimes in the implants. In the old days, they used to sometimes put steroids or other antibiotics in the implants. Nowadays, we just put in just straight saline. And the saline never hits the air when we put it in. We put it from a sterile bag through a sterile tube right into the fill tube. So it's all about trying to keep this as clean as possible. And what can she do after we take this out? Pretty much anything she wants. There's no restrictions. And we try to prepare them ahead of time, showing them an example of what things looks like. Otherwise it can be a little scary to go from full to what looks like empty and wrinkled initially. But like I said, just in a few weeks, things look a lot better. What are we at so far here?
200, 275.
So on the other side, we got out about 370. And I think we're gonna get a little bit less out of this side. Do you remember how much was in the other side, or was it the same?
They were supposed to both be 360.
Okay. Well, we're getting close here. Like I said, if we don't get everything out of it, no big deal. And what you're seeing there is she's so nice and lean that you're seeing the edges of the implant here. The other thing sometimes that makes it look a little strange right afterwards is that with larger implants on thin people, the rib cage can get a little caved in, and that tends to improve with time too, because that pressure on it, I think that's, I'm gonna try one more, but I think that's about it. No, that's it. Okay, ta-da. She did excellent. Now we're just gonna put a Band-Aid on it.